Hi, good afternoon. We are live on Facebook from Aster RV Hospital, Bangalore. Today, I am joined by my colleague, Dr. Divya Fernandez. We both are cardiologists here, and we want to discuss a host of topics related to the heart, hypertension, COVID, etc. So, I would like this to be an interactive discussion. We will talk amongst ourselves, but in between, if you have any questions, just shoot them. We will try to get back and answer those questions. Dr. Divya.
Good afternoon, everyone. To begin with, I thought it would be a good idea if we split this session into the most basics so that everybody who's watching this can understand the basics and know what has to be done when anyone is faced with a situation of a heart-related disease. So the world is going through a major pandemic now. The coronavirus or the COVID-19 SARS-CoV-2 virus which is there, it has gripped the world in fear. A lot of patients, especially our cardiac patients, heart patients, are not coming out of their homes and also trying to delay or hide their symptoms because they are worried because of the complications of the respiratory coronavirus. So in this situation, doctor, do you think that we should be thinking or worried about the heart? Is heart important at this situation?
That's a very important question. See, during this COVID pandemic, we have always been talking about this. There are two issues that concern cardiologists and heart patients. One is that COVID infection has presented itself in many patients with heart-related problems. For example, we know that many patients can present like a heart attack. They have symptoms of chest pain, they go to the hospital, ECG is done, and there they are diagnosed to have heart attacks. They have given heart attack medicines. Some of them have even been taken to cath lab, and angiograms and angioplasties have been attempted, and there they have realized, the doctors have realized that the whole problem is because of COVID, probably mimicking a heart attack. So COVID infection can mimic a heart attack. So this is one important problem. The second problem is that because of the coronavirus infection in the community, patients are afraid, as you said, of going to the hospital. They are worried that if we go to the hospital, we might contract the disease. They are worried that if we go to the hospital, we may be diagnosed to have coronavirus and then be quarantined. They are also afraid of whether the hospitals are open, whether the doctors are working. So because of these, medical attention is also delayed in many of these heart disease patients. So these are the two things. One, we see that many of the patients with COVID infections are presenting with heart-like symptoms. On the other hand, cardiac-like symptoms. On the other hand, genuine heart disease patients are not seeking attention in the medical field.
So as you said, that the number of patients who have a genuine heart problem, they are avoiding their symptoms or coming to the hospital late. So in this present scenario, have you seen any change in your practice? Have the number of patients come down or has it increased because of the infection?
This is a very interesting question, because what happened initially when the COVID pandemic broke out, everyone believed that there is going to be an increased stress. There is also going to be effect of the COVID virus on the heart. Therefore, more and more heart complications, more and more heart patients will present into the emergencies. But what has been seen, not only in a city like Bangalore, in our own practice, but also across the world, what has been seen is the number of heart attack patients attending the hospitals has dropped. So for this, the experts think there are two reasons. One is because of the lockdown, people are exposed to lesser stress. People are working from home. The stresses of traffic, having to see unpleasant circumstances on the road. I think many of these issues have led to lesser amount of stress. People have also become more healthy. I think the usage of alcohol was practically nil during the initial part. Even after that, the use of alcohol has come down. People are probably smoking less. So because of all these factors, we saw that genuinely there are a number of heart attacks have become less. The other thing which may also be, the second thing, is that some patients may have symptoms of heart attack, but because of the fears, as I said, they may not be going to the hospital. So this may present with a situation where there is a delayed treatment of the heart attacks, And therefore, it is possible that over a period of time, we may see more and more people who have got delayed treatment of the heart attack will come with more cardiac complications. So this may be a situation. So what is the moral for us? One is that it looks like the stresses are down, the habits are better, therefore it seems that the number of heart attacks have actually come down a little bit. So we probably should continue with these better life. On the other hand, those patients who did have cardiac symptoms, who did not seek early medical attention, that should also serve as a lesson for us, and we should advise people around us, or we should advise our patients that if there is a cardiac problem, they should seek medical attention.
So in a way, the lockdown has definitely helped India to become a better as well as a fitter country. So that is what you're saying.
Fitter, I'm not sure, because many of our patients are complaining that we are unable to go and exercise, obviously because of the restrictions in social distancing and all that. So in those situations, of course, we are advising our patients to exercise at home, whatever is possible. You have a static cycle, or you have some stairs, you have long corridors or terraces, so we are advising them. But certain habits have definitely got better, so we are telling them. On the other hand, if you look at the food habits of people, snacking has increased, highly processed food, the fast food movement from the super bazaars have increased, so people are eating more sweets, more sugars, more processed food. So maybe it's not all that, so there are multiple factors here. So I think some changes have happened. Some of the things like less stress, less alcohol, and less smoking are definitely better.
So we have seen that many patients come, they say that they have a heart attack situation. Some say that they have pain in the center of the chest, the left side, the right side, the back, the abdomen. So what exactly are the signs and symptoms of a heart attack, and what should the patients be worried when they have these symptoms? How do they recognize an attack at home?
Well, these symptoms have remained before COVID and after COVID. These symptoms remain the same. The commonest symptom of a heart attack remains chest pain. So we talk about chest pain in the middle of the chest, a central chest pain. Many times it is not even a pain. Some people say that I had severe burning of the chest, or some people say that there is very heavy feeling as if somebody has kept a stone, or there is a choking feeling. Sometimes the pain is also seen in the throat. It is seen radiating to the left arm, sometimes right arm, or even to the back. So this chest pain which radiates to different areas will remain the most important symptom of a heart attack. Almost 70% of our patients will complain of this. In the remaining 30%, there can be slightly different symptoms, what we call as atypical symptoms. Some people may simply say that I only have left arm pain. Some people say that just had severe breathlessness, sudden onset breathlessness. Some patients are presented with extreme fatigue. They become very tired and there is no explanation for that. Some people are broken down into cold sweats. There is so much of drenching sweats, and that itself could be a sign of heart attack in some patients. Palpitations or unconsciousness are also symptoms. These atypical symptoms are more often seen in very elderly patients, patients who have been long-standing diabetics, patients who have had kidney disease and other issues. So typically chest pain remains the most important symptom, but these other symptoms can also be related to a heart attack.
So I would like to reiterate the fact to all our viewers that any kind of pain, chest pain, center of the chest or the left side, right side, or anything from the jaw to the middle of the abdomen, if it is increasing in severity, it is more than 10 or 20 minutes, do not neglect it. Don't think it is just gastritis, if it's just a burning kind of sensation. But and since it is a lockdown, do not stay at home. If you feel concerned, always come to the hospital. All the hospitals are open with proper precautions. Everything is taken care of. So always visit a hospital in case you always have a doubt. So doctor, what can a person do at these situations? Is there any first aid they can do at home?
This is a very common question. What is the first aid for a heart attack? So I've always been telling this. There are two first aids for a heart attack. Number one is keep a tablet of aspirin at home and administer that to the person who is probably suspected of a heart attack. Somebody says there is chest pain, give a tablet of aspirin. Now aspirin is of different types. The type which we have to use is called as soluble aspirin. The aspirin which becomes dissolves in water. This I will mention two brand names. These are not the only two, but commonly used brand names. One of them is called as Dispirin or dispersible aspirin, and another one is called Aspisol or soluble aspirin. Ideally, this aspirin, dispersible aspirin, 350 milligrams, should be put into the mouth and the patient should chew it, because as soon as it enters the mouth, the mucosal membrane starts absorbing the drug and the action starts immediately. So that would be the ideal way of taking aspirin as a first aid for heart attack. Other than that, in case the patient is not able to chew for whatever reason, it can be put in a glass of water, it dissolves, and then the patient can drink it up. So that would be the most important, one important first aid. The second important first aid is, we know that as soon as a heart attack happens, there is a risk to the patient's life. Some patients take so long to reach the hospital, sometimes they don't even reach the hospital. So what is important is a timely treatment of heart attack. Whatever is the treatment, the patient has to reach the hospital quickly. So therefore, the other important first aid is to take the patient to a hospital where there is a facility to treat the heart attack, like facility of emergency diagnosis, ECG facility, a physician to see the ECG and diagnose that this is a heart attack, an ICU to keep such patients, to give some important medicines for them, or even to perform procedures like emergency angioplasty. So any of these well equipped hospitals have to be identified, and we have to take the patient immediately to that. That is the second first aid.
So you do follow that the old adage of time is muscle is very important.
Absolutely.
So when we come to this, the treatment of heart attack, we have come a long way from what I have studied in my MBBS, or even probably my parents or anyone. They all must have thought that only bypass surgery is the only option or only treatment option for any patient with a heart attack. But I think we have come a long way from there. We are now in 2020. So we have a lot of list of medications as well as certain procedures. So if you can elaborate on the treatment or the management strategy in case of a heart attack.
So the basic problem with the heart attack is clot forms in the arteries of the heart, and blood flow to one of the areas of the heart is stopped because of that. So removal of the clot, or also called as reperfusion, is the most important treatment for the heart attack. For that, we know that there are two methods of doing it. One of them is injecting a drug called as a clot buster. There are many of these immediately, so that the clot is removed and blood flow is restored. The second treatment is called as angioplasty. In this, the patient is taken to a cath lab, an emergency angiogram is done, and the clot is identified and removed through a procedure called as an angioplasty. So this kind of an angioplasty is called as primary angioplasty. So we know that medicine, that is clot buster or angioplasty, are the two modes of treatment which are given normally in a heart attack. Now I would like to go one more step further and tell you that during COVID infections, what has been seen is some of the patients have not reacted very well with clot buster therapies. Therefore, if there is a facility to perform an angioplasty, the angioplasty would remain as the mainstay of treatment for a heart attack in a COVID environment. Initially, when the COVID pandemic started, people were worried that this patient with a heart attack may be actually a manifestation of COVID, or maybe a heart attack patient also has a coronavirus infection. So in that case, there was a fear that the hospital staff, the cardiologists, the nurses, and the other staff members who are in the hospital would be exposed to this coronavirus infection. This was a great fear, but luckily India has now done a wonderful job. We are now producing as many PPEs as required, the personal protective equipment. Because of that, most of the hospitals have made arrangements for emergency treatment of coronavirus infection, as well as situations like this where we have to give emergency treatment for patients with heart attack. So doctors and nurses and cath lab staff do wear personal protective equipment and protect themselves and are able to deliver these kind of treatment. So now, as it was before in the pre-COVID era, treatment of heart attack will remain the same. In places where the facility is available, angioplasty is the treatment. Where the facility for angioplasty is not available, in smaller towns, or when the patient goes to a hospital where there is no facility for an angioplasty, the clot buster medicine will still be given. Under all these precautions, it can still be done. I would like to ask you a question, Dr. Divya, because I know that I would like to tell the viewers that you are a heart failure specialist, and there is always a confusion that heart failure and COVID infections are being confused in the emergency by patients and doctors. So this question always comes. So let me start by asking, what is this heart failure?
So this is a very good question, and we get this quite often from a lot of patients, especially when we use the word heart failure. So heart failure is nothing like the heart has stopped working or stopped pumping. So think of the heart as a small pump. Its function is to contract so that blood comes out of the heart and to relax so that the blood goes into the heart. So heart failure is nothing but when the efficiency of this pump reduces. So when the efficiency of this pump reduces, the forward flow, that is blood coming out of the heart, reduces and the heart becomes more stiffer. So the patients will have symptoms because of lesser perfusion or lesser blood flow to all the organs. And most common symptoms they'll have is breathlessness because of decreased blood supply to the lungs and all other manifestations. So in this situation, presently the pandemic which we are in, COVID-19, we have seen a lot of patients. COVID-19 can present as asymptomatic patients, which is the highest number, as well as it can be a mild infection like just fever, dry cough, headache and diarrhea. But in severe patients, severe cases, they can present with florid breathlessness. They can come, they're unable to complete sentences, they're not able to walk short distances. So there we have a doubt, is it heart failure related or is it COVID-19 related?
I'll ask you a question. Now, can COVID itself, COVID infection, that coronavirus infection, can it cause heart failure?
So whatever we know about COVID-19 and the heart is just very nascent, because all this data is only of the last 3 to 4 months. So from the data which is mainly from Wuhan, China and from Italy, so what we have seen is a lot of patients, COVID-19 is an inflammatory state. So this causes massive inflammation throughout the body, and heart is one of the organs where the inflammation is quite high. So this inflammation can cause the muscle damage, leading to something called myocarditis and damage to the blood vessels of the heart. So this causes the heart pumping to reduce, and because of which it leads to heart failure.
So you are saying that COVID infection can
definitely cause a
heart failure. But also COVID infection can mimic a heart failure, yes, because of the respiratory symptoms.
Yes, because of the respiratory symptoms, because of bilateral pneumonia. What happens when there is severe pneumonia? This causes hypoxia, that is decreased blood supply in the blood. This causes increased workload on the heart, and because of which the heart is put under strain, the heart pumping reduces. So COVID can act on the heart in 2 ways. One, direct effect on the heart muscle causing heart failure. 2, because of the lung injury, it can cause decreased oxygen and cause heart failure. But a lot of our patients of heart failure are also vulnerable to COVID infections. Why are they vulnerable? Because one of the most common thing, heart failure patients are generally in the elderly group. We see a lot of our patients who are above the age of 60 years. And they also have multiple other comorbidities, diabetes, kidney problems, stroke. So all other issues are there for which they are on medications and all. So by themselves, the heart failure patients are a vulnerable group because their immunity is less. So any kind of infection, bacterial or viral infection, the risk of the infection getting on to these patients is quite high. So these patients are definitely going to be quite high, and they are going to contract the disease quite earlier compared to a normal population.
So therefore they have to take a lot of precautions.
Yes. So we still reiterate the WHO or even the universal guidelines and precautions which we have to follow. Maintain social distancing, maintain a distance of 1.5 to 2 meters when you are outside, and go outside your house only if it is essential. Do not go out only if it is not essential. And always maintain personal hygiene, maintain hand hygiene, use soap and water to wash your hands for about 20 seconds or any alcohol based sanitizers. And this is not only for this episode. I think these precautions should be taken even lifelong for the next 10-15 years also. Even though COVID or no COVID, it is always better that we take universal precautions for all these symptoms.
And also I think it's good to inform our viewers that most of the hospitals have now given the facility, started the facility of teleconsultations or video consultations, including our hospital. I think patients who are stable, especially those heart failure patients who are stable or hypertension patients who are stable, should try and avoid coming to the hospital because they are vulnerable, and make use of these facilities. Most of the doctors are available on teleconsultation, so I think that would be a good modality. I think we are going to see a lot more video and teleconsultations happening in future. Our world is likely to change in that case, so we may not have more physical consultations for stable patients. So that I think we should encourage.
So digital health consultation definitely is the way forward, and that is one thing which Aster RV is already pioneered in it. Teleconsultations and video consultations are going on throughout. You can always reach us through teleconsultation. Do not think that because there is a lockdown, you're not able to go to a hospital. Doctors as well as the medical staff are always available. You can always consult us through teleconsultation. So what are the other precautions now, since people are at home? So what else can they do to prevent a heart attack or a heart disease? What are the precautions that they can take at home?
I think the basic lifestyle changes are going to remain. So we would actually tell patients to be a little more careful about their diets. As I said, ultra processed food, snacking has increased during this time, so they can look at that. Their habits can still be better. The two other factors which are commonly implicated in heart attacks, that is diabetes and hypertension, these could be monitored better because you are at home and you are on your own. Some of us may not be able to go to the doctors and get these tested. So I think there is an increased requirement of adapting self-monitoring. For example, hypertension. I think hypertension can be monitored at home because hypertension is a very common condition. Almost 25 to 30% of our adult population is suffering from hypertension. Hypertension can lead to heart attack through various ways and many other complications. We can manage this hypertension better at home. So home monitoring of blood pressure is probably one of the important changes we can bring about during this time. So in fact, one of the questions that is asked is how do we check our blood pressure at home? So what kind of instrument that can be used? So these are common questions that are asked for. So what I would like to request you is if you could tell our viewers as to what are the precautions and when do you check the blood pressure, what precautions, and probably if you could demonstrate to us how we can do. I would request my colleague Sachin to come forward so that Dr. Divya can explain and also show how it is to be done. So you could first tell what are the when to check.
So one thing is that digital monitors are definitely the way forward, and this is an example of one. This is an Omron digital monitor. There are a lot of digital monitors available all over India. The most important thing is any digital monitor you buy, always get it validated or calibrated in a hospital. Check your pressures with this machine as well as the pressure in the hospital machine. See the difference in about 2 to 3 patients also, and then because there will be a fluctuation about 5 to 10 mm will always definitely be there. So always get it calibrated before you take it home. And then whenever you check your BP at home, the best place and the best thing is the person should be comfortable and should be the best thing will be sit in your dining table, because you have a table, you have a chair, you have a backrest like this. So you are comfortable and you seated well. Before you check your pressures, a certain precautions have to be taken. So what are those precautions? The most important thing is do not have any food, any snacks or any meals for at least 1 hour before you check your pressures, because this will affect your BP readings. Along with that, avoid caffeine, tea, coffee, avoid alcohol, avoid smoking for at least 30 minutes to 1 hour before you check your pressures. Avoid any kind of exercise before this, because this will again alter your pressures. If possible, have an empty bladder and empty your bowels before the procedure. And then when you have come, you have to be seated in a comfortable chair, most likely in your dining table, which comfortable chair. Uncross your legs. Do not cross your legs, because that again will cause fluctuations in your pressures. Uncross your legs. Keep your feet firmly on the ground. and sit comfortably. Sit in this position for at least for about 5 minutes and you're relaxed. And then keep your arm on the table, extend it, be relaxed. If you have a cloth, if you're wearing a full sleeve shirt, you can try to lift it up. But in case when you're lifting it up, you get wrinkles in this area, avoid it, because wrinkles again will cause your pressures to have a false reading. Coming to the machine, so this is the BP arm cuff. So the most important thing in an arm cuff is there are various sizes. So there can be a pediatric age group, a smaller size, or there can be very large age group. So how do we know which size the cuff is the best? So I think we can see here, there is a black line here. It says there is a range. So it says a minimum as well as a maximum. So when you're tying this cuff, if it goes above this, across this minimum area, that means the cuff is very small. In case when you tie, it comes below here, that means it is very big. So I will show it to you, I will demonstrate, and along with this, so this is one line which you have to always check. Along with that, there is another point which once I put it, I will let you know. This arm cuff should at least cover 2/3 of the arm. It should be in the center of the arm, and from your elbow joint, at least about an inch above, you can tie it. There is something called there is an arrow mark which is here. So this is the arrow mark for the artery side. So this comes towards the center of the elbow. So once you are done, you fix this. Once you fix this, check if one finger space is there. If it is one finger space, that means you have fixed it correctly. Suppose you have 2 finger space and all that, that means it is loose, you have to tighten it more. So this is the correct method. The patient relaxed position, you have the arrow mark which is facing to the artery. The arm cuff is 2/3 of your arm, and this is the way. Then you switch on the instrument and then wait for the pressure readings to come. So we have 2 readings in this, a systolic as well as a diastolic reading. Most of the BP monitors also have a pulse recording also. So this is the way we can check your blood pressure with a digital monitor at home.
Is one recording enough?
So whenever we do a recording, especially a digital recording, we always tell, check the pressure once, wait for about 5 minutes, check your pressure again. In case the variation is about 5 mm between the first and second reading, it is okay. But if there is a severe, there is a strong variation more than 10 mm, that means you have to check it again. So always better take 3 recordings and take an average of that, or best possible take the second reading. So that will be always better. And also with this, when do we tell patients to check the pressures? How often do we check the pressures? That is also one thing the patients always keep asking. So this is one of the readings, 99/67, which falls in the normal range.
So in a normal adult, how often do they check blood pressure in a year, for example, or should everybody be checking their blood pressure, on a daily basis or something?
So in patients or in the people who are less than 40 years with no comorbidities, no strong family history, active lifestyle and all that, once in a year, once in 2 years, they can check their pressures. But in a person who has been diagnosed to have hypertension, who says, okay, the BP is quite high, they have been started on medications or at least lifestyle modifications and all that, at least once in 3 months, 1 to 6 months, we can check. If they are elderly, not above 80 years and all that, with no other problems and all that, once a year also is okay.
So I generally follow this rule that anybody who is above 18 must check their blood pressure at least once a year. Above 40 or anyone who is a diabetic probably should check blood pressure once in 6 months. In case a patient has been diagnosed to be a hypertensive and the patient is on medication, they simply follow their doctor's advice, because sometimes the doctors want them to have more often, more frequent monitoring, or sometimes if the blood pressure is well controlled, the frequency may be dropped. So I think once a hypertensive has gone to a doctor and the doctors have advised, it is best to follow the doctor's orders. Otherwise, if you are not a hypertensive, above 40 or a diabetic, every 6 months once, and above 18, and not a diabetic, maybe once a year. I think blood pressure is a very common problem, and to diagnose early, to treat well, will prevent a lot of complications.
Okay. So along with that, so let's get down to numbers. When we talk about hypertension, people, and especially when now people are at home, they're checking their pressures many times, 2-3 times in a day, and they're worried, okay, it is not 120/80. I think all of us have learned it in school also. 120/80 is the normal pressure. So what, according to you and according to the guidelines, is considered as a normal blood pressure reading?
This is a very controversial, I won't say controversial topic, a confusing topic. Because every few years, some new international society will say that this is the normal blood pressure and this is hypertension. So I think a lot of confusion has gone around. And even today, if you look at Indian Society of Hypertension or European Society of Cardiology or American Heart Association, all of them will recommend different levels of blood pressure as normal and different levels of blood pressure as hypertension. I think without confusing ourselves, we can say, looking across, that normal blood pressure is 120/80 and hypertension, we can safely say, is 140/90 and above. So in between 120 and 80 and 140 and 90, it is slightly higher blood pressure or pre-hypertension, or borderline blood pressure, or whatever one wants to call. Different societies have given different nomenclature, but those are the patients who have to be a little more careful. But I think treatment, whether it is in the form of drugs or more intensive lifestyle monitoring management, has to probably start once it is 140/90. And also, a single reading will never label a person as a hypertensive. There has to be revalidation. So today, if somebody has a blood pressure of 140/90, probably within the next 1 to 2 months, few more readings have to be taken and we have to confirm that it is high. Supposing somebody's blood pressure is very high, 160/100 or 170/100, then we probably should not be waiting for 2 months. We should be getting it validated within the next 1 or 2 weeks, and to make sure that the blood pressure is not high, or if it is indeed high, an early treatment probably has to be started. So blood pressure above 140/90 we can consider as hypertension. If consistently high BP is found, then treatment will become important.
So the main number to remember is 140/90 and not 120/80. If your pressure is 121/82, do not worry. But if it is consistently above 140/90, then definitely come and visit us. So why are we so much worried about hypertension? What does it cause? What are the complications associated with it?
Hypertension is a very large problem. I think controlling hypertension can reduce a lot of problems in the society. Now, uncontrolled blood pressure for a long period of time can cause strokes, brain hemorrhage, heart attack, heart failure, kidney disease, and many other problems within the arterial system when it is uncontrolled. So blood pressure is an important disease. It goes without symptoms often, and it is therefore called a silent killer. So it's a very important disease. And it's the best thing about blood pressure is it can be easily detected. A simple instrument, a single reading can tell us whether we are hypertensive or not. It doesn't require any blood tests. You don't have to go to a lab to get all this checked. So I think hypertension is easy to detect. If we accept that one is hypertensive and we take care of controlling, I think a lot of complications can be reduced. So are there any questions from our viewers who have been
We have got a few questions from our viewers. One is it okay to take aspirin for chest pain even if it is not a cardiac patient?
Oh, well, this is a very important question actually. See, how do we know a patient is having a heart attack? Sometimes we have seen that patient who looks specifically like a heart attack turns out to be it is not. Patient comes to the hospital, we do ECGs and we do blood tests, and finally what looked so much like a heart attack turns out to be something else. Similarly, there are a lot of patients who feel that they have gastritis and they say that I don't have a heart problem, and when we check, we realize that the patient is actually having a heart attack. So it is very difficult sometimes to distinguish between a cardiac pain, heart attack, and a non-heart attack pain. So therefore, taking aspirin should be a first aid in any patient in whom even a suspicion of heart attack comes. Supposing somebody has a burning in the upper stomach, it could be a gastritis or it could be a heart attack. There is no harm in giving an aspirin tablet and taking to the hospital. And once the patient goes to a clinic or a hospital, a doctor examines, does an ECG and then declares that it is not a heart attack, that one tablet of emergency aspirin is not going to harm. On the other hand, if it is indeed a heart attack, it is going to protect such patients. So the answer to this question is, it is fine for a patient to take aspirin for chest pain even when one is not sure that it's a heart pain.
A very good question has come across. Does your body warn before you have a heart attack, or are there some impending signs which are going to say that you are going to have an impending heart attack?
Well, if you going by personal experience or also what is documented in the literature, there are times when many patients have worsening of their symptoms, or if they have never had any symptoms, some warning symptoms coming. So there may be a patient who is known to have a heart attack, heart disease, has been having infrequently some chest pain, what we call as angina. So now suddenly the patient's angina worsens. Instead of coming once in a week, it starts coming every day. Or usually somebody has angina attack for about 5 minutes or 3 minutes, it starts lasting for a longer time. Earlier the angina pain was less intense, now it starts becoming more intense. So that is a warning that something is going on, because of which patient is having a possibility of an impending heart attack. Many patients who have never been heart patients as well have been telling that last few weeks or few days there has been some burning, some indigestion, some inability to walk. So there are in many patients impending premonitory symptoms which say that there was something to do with the heart, and then the heart attack happens. But it is not always true. It is not necessary. Some patients suddenly have a first episode of chest pain that turns out to be a heart attack. So while we recognize that there are patients who come with early symptoms, and if they had come before, we could have prevented the heart attack. That is possible. But many patients don't necessarily have these symptoms as a premonitory.
We have seen that most of the patients have attacks early in the morning, 2 to 4 a.m., 6 a.m., or most of them die in their sleep. So is there any particular reason why do attacks occur early in the morning?
This is an interesting question. I'll answer this. We are also, I think, coming towards the end of our half an hour session, so I'll extend it by a few minutes with our viewers' permission. And after this, we can always take more questions. If you have any questions to ask me or Dr. Divya here, please post it in the comments and we'll get back to you and answer them. We also would like to have similar informative interactions with all of you. For this particular question, that whether heart attacks are more during a particular time of this thing, it's early morning, as you said. What is typically noted is, according to the circadian rhythm, early morning, maybe after about 5-6 o'clock till about 12 noon, the hormonal changes in the body, the activity hormones start increasing. So there is an increase in blood pressure, there is an increasing pulse starting from about 5 or 6 a.m. and it goes on increasing till about 12. So during this period, when the hormones like adrenaline and noradrenaline increase in the body, that is when the heart attacks seem to be more clustered. So if you look at a 24-hour period, more number of heart attacks happen in the wee hours, early hours of the morning than other times. So this is, but of course, heart attacks could happen at other times as well, but more often it is seen in this time. So this is basically a function of the circadian rhythm and the kind of hormonal changes we have. Dr. Divya, it was a very fine interaction. I think you gave a lot of information, especially the thing about how to check blood pressure, when do we call blood pressure as hypertension, how often we have to check is very useful. We have reiterated the social distancing and precautions against COVID. I think we also discussed a few points about heart attack and COVID infection itself causing, mimicking a heart attack or mimicking heart failure, or COVID infection causing a heart attack or causing a heart failure. So I appeal to all our viewers that stay safe, come to hospitals only when there is absolute necessity, but when there is a necessity, please don't stay back at home. If there is an emergency, seek out your doctors. And distance consulting is becoming more common. Please seek out video consultations or teleconsultations with your doctors. Stay safe. The country is going to go through an increasing number of cases, and it is experts' opinion that till I think mid or end July, the number of cases are going to increase. Those who are hypertensive, those who are diabetics, those who are patients of heart disease are more vulnerable. Please take care of yourself. Please take care of your dear ones, near ones in your houses, and all of you stay safe. For any emergencies, please do consult your doctors. Thank you very much. Thanks, Dr. Divya.
Thank you.